The first time I had an episode with cervical dystonia, I was 13 years old, taking a shower, getting ready for school, and I put my head back in the shower and got what they call acute lateral colitis, which is when you get stuck with your ear to your shoulder. They put me in the hospital in traction for 2 weeks, tried to sort of stretch my neck out and release the muscle. From then on, I wore a neck collar for almost a year. I had physical therapy 3 to 5 days a week, had chiropractic, massage, steroid treatments, you name it, they did it to me. During my teenage years, I basically saw osteopaths, chiropractors, acupuncturists, massage therapists. Nobody ever seemed to know what was wrong with me. When I was 28, I was in a severe car accident. I got severe whiplash, which extremely exacerbated the cervical dystonia in my neck. And I had a top neurosurgeon in the area who even then could not properly diagnose me. As far as my neck position and pain, I would say 80% of my cervical dystonia was severe pain. It would be like waking up with a kink in your neck tenfold, So some days I would wake up with lateral colitis, meaning, kind of ear to shoulder, kind of stuck like this. Quite often my head would get stuck off in one, sort of like a banana, like my chin would be here and my neck would be over here. A lot of times I was out sort of like a peacock. Going from one doctor to the next with no diagnosis is extremely frustrating as well, because in general they look at you as if you're crazy, that you must be having other problems that's making your neck, spasm like this all the time. Last September, I was referred to my neurologist, who I have now. He said, "Kathleen, you have cervical dystonia." He said, "Has no one ever told you this before?" And I said, "No." He explained to me at that point, he said, "What I'm going to do is inject you with Botox." He was going to inject me with Botox, and that would allow my muscles to relax a bit so that they would stop chronically pulling and aching and making me so stiff and in pain. He injected me down my sternocleidomastoids on the front of my neck. I started having mobility that I hadn't had in so long. I could move my head like this, and my vertebrae were actually popping around and adjusting. So I was just amazed. I thought, this really is a muscle problem. This is not my bones. My bones are not stuck. This is the muscles in my neck that needed to be relieved. And I did have a little bit of a side effect. I felt like I had the flu for about 4 or 5 days. The one thing that was the biggest thing for me was that I woke up in the morning and I could go wash my face and brush my teeth. It was like, I cannot believe my neck doesn't hurt anymore. And also I stopped doing this all the time, because I was like this all the time. It was like my hand was stuck on my neck, and I had absolutely no neck pain. My neck doesn't have the ability to grab and hold. Occasionally, if I overdo something, my neck might grab for a second, and then I'll just stop and take a deep breath, and then it just releases. It's like it just doesn't have that power anymore to hold on to me. So no more neck pain.
Botox, onabotulinum toxin A, important information. Indications. Botox is a prescription medicine that is injected into muscles and used to treat increased muscle stiffness in elbow, wrist, and finger muscles with upper limb spasticity in people 18 years and older, to treat the abnormal head position and neck pain that happens with cervical dystonia, CD, in people 18 years and older, to treat certain types of eye muscle problems, strabismus, or abnormal spasm of the eyelids, blepharospasm, in people 12 years and older. Botox is also injected into the skin to treat the symptoms of severe underarm sweating, severe primary axillary hyperhidrosis, when medicines used on the skin, topical, do not work well enough in people 18 years and older. It is not known whether Botox is safe or effective for other types of muscle spasms or for severe sweating anywhere other than your armpits. Important safety information. Botox may cause serious side effects that can be life-threatening. Call your doctor or get medical help right away if you have any of these problems anytime, hours to weeks, after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, dysphonia, trouble saying words clearly, dysarthria, loss of bladder control, trouble breathing, trouble swallowing. There has not been a confirmed serious case of spread of toxin effect away from the injection site when Botox has been used at the recommended dose to treat severe underarm sweating, blepharospasm, or strabismus. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. These reactions include itchy rash, swelling, and shortness of breath. Tell your doctor or get medical help right away if you experience any such symptoms. Further injection of Botox should be discontinued. Do not take Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin products such as Myablock or Dysport. Have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions such as amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects including severe dysphagia, difficulty swallowing, and respiratory compromise, difficulty breathing, from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have plans to have surgery, had surgery on your face, weakness of forehead muscles, such as trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Botox may cause loss of strength or general muscle weakness or vision problems. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information on Botox, please see the accompanying full product information, including medication guide.